Hello everyone, this is Dr. Arindam Chattopadhyay and I'm one of the family medicine or general practice trainees in the east of England. And today we are going to talk about the 5 apps which I think are a must-have for all the doctors who are starting to work or are already working in the NHS. And without any further ado, let's get started. I think the first most important app that everybody um, not even doctors, everybody working in the NHS or any trust should have is an app called Induction. Now, what Induction is a collection of all the directories for anything in whichever trust you're working in. Um, Including any sort of particular services, any bleeps, any extensions that you could possibly use. I remember when I started off in the NHS, this app was of tremendous help in the fact that every trust that I've worked in, I did not know all the extensions, and this app just takes you right there, especially the bleep from the medical registrar, which is the most important one that everybody should literally remember. But yeah, except for that, any other services like, for example, any consultant bleeps or any other service in the hospital, any specialist nurses who carry a bleep or an extension, this app will give you everything. So that's one of the apps, very useful. It's available for both Android and iOS. The second app that I would like to mention, obviously for doctors, is the BNF app, which is very useful in prescribing any sort of medication to anybody. It's very useful, especially when you're not sure of the dose, you're not sure of what are the exact indications, which are very important for you to know. So it's obviously something which acts as a reference guide, and it really helps if you have this particular BNF app, which stands for British National Formulary, for both adults as well as children, in your pocket. And obviously, again, I remember, like, even to this day I have to use them because of my limited experience, especially in pediatrics, because the dosages of all the medications are very different in all age groups, and it's obviously not possible for everybody to remember such dosages. So this app obviously comes in handy, and I think all of my colleagues should have this particular app. The third app that we are going to talk about is an app known as MicroGuide. Now, MicroGuide is the latest microbiology guidelines for your particular trust. So if you download this app, it will ask you which trust you work in, and once you select that, it just downloads the microbiology guidelines for both adults as well as children, including COVID guidelines for your particular trust. It is a very useful app to have, especially when all the antibiotic guidelines change. Any change in the antibiotic guidelines can throw you off, especially when you're trying to prescribe any sort of antibiotics for any condition. I remember that when I was working in stroke medicine in East London, I had to basically remember the antibiotics for aspiration pneumonia, which is a common complication of stroke, and the antibiotic guidelines had changed, so I kept referring to this particular app so that I was kept updated every step of the way, and obviously it benefited all my patients. The next app that we are going to talk about is known as, it's a kind of a calculator app, but it's for medical professionals mainly, and that app is known as MD Calc. Now this app is very good in terms of calculating any sort of scores that you might want to consider. When I was working in stroke medicine, I had to calculate the CHA2DS2-VASc, has blood and creatinine clearance for any patient who was diagnosed with atrial fibrillation, and we had to anticoagulate them. So I use this app personally every day, and this is a very useful app to have. And you can get all sorts of calculators. For example, there's also the calculator for calculating the Rosier score, which is also useful in stroke, especially in the emergency department. But I'm sure any sort of calculator that you could possibly require in calculating a score for a particular condition. Another score that comes in handy in this particular app is the Curb 65 score, which is obviously for pneumonia and to measure the severity really. And based on that, you can, that will basically determine your further management for this particular condition. The other app that is quite useful is known as the PocketDr app. Now, this app is quite basic, but it is very useful in the sense that it will give you all the guidelines or the most commonly used medications that we have for any condition such as constipation, in terms of laxative, which is the most commonly used one, what are the brands which are commonly used. The other thing that's quite helpful in this particular app is especially the electrolyte imbalances. That's also one of the apps, the app usage that I get the most out of this particular app. In terms of other things that it has got the most common conditions that you can possibly get when you're on call and carrying a bleep, and basically how to quickly assess the patient and what are the considerations that you need to have, or things to keep in mind. So obviously whenever you get a bleep, it would be quite useful and handy to basically open this app up and then quickly look at what are the important things that you need for the assessment of whoever is this unwell patient. So very useful, handy to app, especially on calls and day-to-day working in the NHS. So that completes my 5 must-have apps for my colleagues working in the NHS. I would be very interested to know what are the other apps that you've found useful. You can obviously mention them in the comments below, and basically I really hope that you have found this useful, and I'll see you in my next video. Thank you.